Water park slides. They're so much fun, right? But did you know that water park slides can cause vaginal trauma? Stay tuned because you're going to want to hear this. Let me first tell you about a case that I had. There was a patient who was about 2 to 3 months postpartum who went to the local water park, went down the biggest, newest, shiniest water slide there. As she was going down, her swimsuit bottom went off to the side. Water went into her vaginal vault. Hydro dissected her uterus off of her vaginal vault into the peritoneum, caused hemorrhage and a lot of complications. Let's discuss why this happens. The info I'm about to present is from this article right here, Water-Related Vaginal Injury, a case report and review of the literature from 2018, the Journal of Obstetrics and Gynecology, Canada. High-pressure water jet vaginal injuries, sometimes referred to as douche injuries, occur due to entry of water into the vaginal vault under high pressure. This can lead to vaginal injuries and trauma, leading to severe bleeding or hemorrhage, intraperitoneal injury, and even death. These injuries can occur with water skiing, jet skiing, going down water slides, using a water hose, or at a water fountain with the jets. Water skiing is the most commonly reported sport, placing adults at risk for vaginal injuries. And going down a water slide or injury from a water hose places pediatric patients at the highest risk for vaginal injuries. Let's talk about why this happens. As someone falls backwards on a water ski, for example, or goes down a water slide backwards with their legs open, that water can hit the perineum and then enter the vaginal vault. As you can see here, the water enters the vagina, the vaginal vault, then behind the cervix, it can go into the genital tract and also into the peritoneal cavity as the vagina stretches with that water being forced inside. Water can also enter the rectum. When considering water entering the vagina, it can go into the vagina, tear the perineum, the vaginal vault, go up behind the cervix, tear the cervix off of the vaginal vault, which can allow water entry into the peritoneal cavity, and even out to the sides where the broad ligament is on each side of the uterus that supports the blood flow to the uterus and also the fallopian tubes and the ovaries. There are a lot of vessels there, so it can bleed a lot. As you can see with the arrow here, the vector of the hydrostatic force of the water is directed towards the back side of the uterus where the posterior fornix is and into the posterior cul-de-sac, which is internal. That area can open up, leading to entry into the abdominal cavity. Rectal injury is more common with someone who falls off as a passenger on a personal watercraft. These types of injuries have been reported in patients anywhere from age 9 to 44. And potential complications include salpingitis, tubo-ovarian abscess, miscarriage, infertility, pelvic abscess, and inflammatory disease. Here are some recommendations on how to prevent this from happening.